Senator Hirono.
Thank you, Mr. Chairman. Thank you all for testifying. I know that every time we compare pharmaceutical prices, we are told that Europeans pay far, far less. But I do acknowledge, as you said, Professor Mossoff, that our healthcare system is very complicated. You're the only person on the panel who happened to mention that other nations have single-payer systems. In our country, adding to the cost of healthcare is depending on how you get injured and what system is kicking in to take care of you. We have the VA, the largest healthcare program in the country. We have private insurance. We have Medicare. We have Medicaid. In Hawaii, we depending on if you get hurt in an auto injury, then that's another system. So I think that, if you there is no single bullet. And for us to just, I realize that the patent system abuses is part of the problem, but for us to sit here and just point our fingers at the patent system is not going to resolve in the kind of non-silver bullet that we also acknowledge. And in fact, Professor Mossoff, would you like to just very briefly go over why the payer system we have in our country, if you have any information on how much that adds to the cost of healthcare in our country, I would appreciate your thoughts.
Thank you for the question, Senator. I don't have any specific data on the total costs of all of the different complex institutions, public and private, that exist in our healthcare system, except for the fact that I know generally as a scholar it is incredibly complex and it makes other systems look very simple and basic.
Yeah, and I think that if we really wanted to get control over the United States having the highest healthcare costs in the country, we should look at the payer systems that we have in place, but that's not what our focus is right now. It is clear that we do have abuses in the patent system, and I think it is important for us to very carefully target the abuses as opposed to passing legislation that is going to be overbroad. Would you say that some of the bills that we have passed out of this committee precisely target the abuses in the patent system? Anybody wants to weigh in on this? I think you're familiar with some of the bills that have emerged from this committee.
I think the bills are targeted effectively. The bills target citizen petitions. They target pay-for-delay settlements. There are very specific things that these bills go after that I think would undoubtedly improve some of the patent gamesmanship that we've seen. But I don't think these bills go far enough. I think there are numerous other targeted solutions that are simple and would help improve things.
Such as
have the FDA review every patent that gets submitted to the Orange Book. The FDA currently serves in a purely ministerial role. It doesn't look at the patents. The companies can submit whatever they want. So give the FDA the authority and the resources to review those patents. Force manufacturers, when they submit patents for listing in the Orange Book, submit them for re-examination to the USPTO. Very simple, but making sure that these patents that are listed in the Orange Book aren't being listed improperly.
Would the rest of you agree that those are some so-called simple changes where there's more collaboration, I suppose, information sharing between PTO and FTC, for example?
FDA and PTO, yeah, absolutely. I think that, and also Professor Dr. Feldman's point about the FDA's so-called ministerial role could be fixed really readily and inexpensively if the FDA and PTO collaborated on every patent that was listed on the Orange Book to ensure that it's properly listed. This is a gap in the system that has existed for decades, and it's really unclear, to me at least, why this gap has not been filled.
Thank you for that suggestion. I have a question for Dr. Feldman. Last year, insulin prices were cut dramatically after surpassing the rate of inflation year after year. In a paper last year, you cataloged the, quote, the rise and fall of the insulin pricing bubble. I'm not talking about the situation where the legislation capped the insulin costs for Medicare. This has to do with insulin's costs for everybody else. Can you give us some insight into why prices rose so high, why they fell so dramatically, and whether that experience points the way toward possible policy solutions we can use for other high overpriced pharmaceuticals?
Thank you for the question, Senator. The reason why the prices of insulin rose so dramatically is because the three large insulin manufacturers obtained numerous patents to limit competition. They raise prices year after year, many times the original prices of these products. And the reason why prices came down so suddenly is that a rule in Medicaid lifted the cap on rebates, on penalties that these companies were going to have to pay. So previously it was capped at 100%, where if a patient used one of these old insulin products in Medicaid, because they had raised prices faster than rate of inflation year after year, they had to pay these very large penalties that were capped at 100%. They are no longer capped at 100%. And so insulin manufacturers responded by dropping their list prices.
So there are other ways that we can lower drug prices by, for example, impacting what PBMs are getting. Is that part of the approach that we should consider?
I think we absolutely should consider legislation that addresses PBMs. I think some of the things we've talked about here today, like spread pricing, the lack of transparency, all of these contribute to higher prices in the system. But I would say just on this question about insulin prices and why they came down so dramatically, it's a rule that forced manufacturers to pay penalties for raising list prices greater than the rate of inflation. And so I think with the IRA, we will see similar types of penalties moving forward. And I think, again, we need action with the pharmaceutical companies, and we also need action with PBMs.
Thank you, Mr. Chairman.